Let us discuss history, physical examination, and arterial blood gas analysis, and early warning score about the COVID patients either suspected or confirmed. We are discussing under the headings of history, physical examination, blood pressure and oxygen saturation level estimation, blood gas analysis, venous access, enteral feeding, and early warning scores. Let us discuss history taking. History taking. First of all, we have to note down the chief complaints with the patient, presenting symptoms of the patients. Usually the patients present with the fever, mild to moderate, sometimes severe intensity, fever with 1 or 2 weeks duration. Usually most of the patients are having mild to moderate fever with mild throat symptoms, throat discomfort, generalized myalgias, weakness. But in 10 to 15% patient, we notice that patients after one week of the fever, they develop shortness of breath due to cardiopulmonary involvement. Usually it is due to the interstitial pneumonias. This is caused by the COVID-19 infection. Many patients also have complaints of the chest pain, maybe due to interstitial pneumonia, or sometimes it is due to involvement of the coronary arteries, and myocarditis itself may be a complicating factor in cases of severe COVID infections. So most of the patients develop usually uneventful disease course and usually recover within 1 or 2 weeks, but only 10 to 15 patients who develop severe shortness of breath, usually having the oxygen saturation level less than 90%, they require 90 or 92%, less than 92% patient should be admitted in wards. And patients having severe shortness of breath, usually the oxygen saturation level less than 88%, who are severe oxygen deficit patients, should be admitted to the intensive care units. First of all, they have to be provided with non-invasive ventilation support, and if they are not maintaining adequate oxygen saturation, they may be put on ventilatory support, and other modalities of the treatment should be instituted, like steroids, antiviral medications should be started. Physical examination. In physical examination, first of all, we have to note down respiratory rate, note down the respiratory rate. Usually the respiratory rate, if the patient develops more than 24 to 30 respiratory rate per minute, it is severe, moderate severity, and more than 30 per minute respiratory rate patients are usually in severe respiratory distress. And temperature should be noted down, and blood pressure, systolic blood pressure also should be recorded. And patient with hypotension should be given fluid resuscitation, and if needed, patient should be given vasopressor support. पल्स ऑक्सीमीटर उसके बाद हमें एक्सपेक्टेड तो पहले फिजिकल एग्जामिनेशन कंटिन्यू कर लेंगे. Patients with who are comatose or not responding to the verbal stimuli or painful stimuli should be put down in the intensive care unit, and they have to be also provided with enteral nutrition to Ryle's tube insertion. And also these patients, for these patients, because some patients are having cardiac involvement, and proper and timely intervention to these patients having the cardiac involvement may save the patients. And many patients, even COVID patients, are also at risk of the development of myocardial infarction due to coronary arteritis, or thrombotic episodes are also very common in COVID patients, and these patients should be put on timely instituted with the antithrombotic medications, and antiplatelet therapy should also be given to these patients to prevent the cardiovascular events. And oxygen saturation level, of course, if falls below 90%, these patients should also be in the initially non-invasive ventilation. And then if the patient is not maintaining oxygen saturation, then they must be provided with the invasive ventilatory support. These patients may be categorized according to the National Early Warning Score. These patients, we may categorize these patients to early warning score. This score has been devised in 2012 for respiratory and critical respiratory patients, and this is may be useful in case of the respiratory patients, and usually 5-6 parameters are there to categorize such patients, and according to the early warning score, National Early Warning Score, shortly in mnemonics we call NEWS, like systolic blood pressure, temperature, consciousness or orientation to time place person should be recorded, and oxygen saturation and pulse rate and respiratory rate. These are the parameters to categorize such patients into different categories as per the National Early Warning Score system.